Hi, everyone. Good morning. Let's get started. My name is Pamela Robinson. I'm the interim director of City Building Ryerson. I'm also the director at the School of Urban and Regional Planning here at Ryerson, where I'm a professor. Thank you so much for joining us here today. We'll start today's webinar with a land acknowledgement. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, the Mississaugas, the Haudenosaunee, and it binds them together to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. We share the land acknowledgement, even though we're meeting virtually, as a reminder of the land on which Ryerson's campus sits, and part of our acknowledgement to build new, more durable, equitable, and inclusive relationships with Indigenous community members so that we might learn from their experiences and also set our university on a new path towards truth and reconciliation. I have a few housekeeping matters today before we get on with the research that you all came here to see. What we'll start with today is a presentation about the presenter's research, followed by a moderated question and answer period. This takes about 30 minutes. As you know, this session is being recorded. After this, you're also welcome to participate in a more technical question and answer period in the back 30 minutes of this session where we can deep dive in. Your microphones and cameras will be off, and you can use the question and answer window at the bottom of your screen at any time. You're welcome to also vote up other people's questions that you find compelling so that we'll get to them sooner rather than later. This webinar, along with the other ones in our series, are being recorded, and they're also posted on the City Building Ryerson website, so you can come back and watch it again, and you're also welcome to share it. It's my tremendous pleasure today to be able to share with you Dr. Josephine Wong. Dr. Wong holds the positions of Professor and Research Chair in Urban Health in the Daphne Cockwell School of Nursing at Ryerson University. Dr. Wong's teaching and research focuses on social justice and health equity. She has extensive experiences in community-based action research, intervention, and implementation science and knowledge translation. In this presentation, Dr. Wong will share with us the research that she's leading called Project Protect, a multi-pronged intervention and action research project to reduce COVID-19 stress in related professions that include frontline healthcare providers and community members experiencing loss and grief, as well as mobilizing efforts to reduce COVID-19 racism against Chinese and Asian Canadians. I'm going to pass the microphone over to Dr. Wong. Thank you so much for joining us.
Thank you very much. Thank you, Pamela and City Building Ryerson for inviting me here to spend time and have a dialogue with everyone. So I'm going to share my screen of a short PowerPoint. So I've learned through teaching that I had to do the share screen twice, otherwise it wouldn't work. As Pamela had kindly introduced, I'm going to focus on a project that I am currently working on, and is to reduce pandemic stress as well as reduction of stigma. And the key themes that I would like to share is really about how I myself and my team learn from the past and how we're responding to the present and how we would like to gather all the information and all that is happening in the community and from our research to actually inform the future. So our project is called Protect, and our funding reviewers actually thought that we were very smart with our acronym. And it's Pandemic Rapid Response Optimization to Enhance Community Resilience and Health. So some of you might have already read this report. In 2003, that's when Canada kind of woke up that pandemic is possible in our country. And we were not prepared. There were many devastating stories that came out. And this was the pandemic that actually led to the establishment of the Public Health Agency of Canada. And they have written a very detailed report, and the quality of the report is actually quite high quality. And I would suggest that when you have time, and if you're interested in the midst of COVID-19 to actually look at what have we really learned and carry out from SARS. And what came out from the pandemic of SARS in 2003 was that we recognized that it was not just a communicable disease that was happening. The social and political aspect of SARS was actually quite tremendous, not for all Canadians, but mostly, especially people who were affected. So they are the frontline healthcare providers working in hospitals when we didn't really know what is going on. Now, because of that lessons learned, we had hospitals that actually had, a special room that had different kinds of air pressure so that the virus or the infection could actually be kept in isolation. But a lot of things that came out at that time was really social and political. There were lots of fear. There were lots of inequities and racism that actually, again, rose up from the incident based on people's fear. But I personally feel that racism had always existed, and incidents like the pandemic, SARS, COVID-19 right now, actually really just kind of bring them out and intensify them. And it seems to give some people permission to feel that they can act violently towards different group. But when we look at what is happening with COVID-19 and who had been affected, the unequal distribution of infection rates amongst people who are racialized, who are living in low income, people who experiencing homelessness, then we know that really some of the lessons that we are supposed to have learned, actually we didn't quite learn over the last 17 years. So as early as January 2020, there were already news media story coming out that there's anticipation that Chinese and Asian Canadians will be facing hate and racism. And on my right, there is an article that was written that actually document that the whole idea about racism towards Chinese and Southeast Asian communities are deeply rooted way back to more than 150 years, 200 years. When the world was going through, this Eurocentric colonialism, that those type of symbols, those types of ideas about racialized group, those type of ideas that certain so-called socially constructed racialized groups are inferior, or comparing them to diseases, they are lesser human. Those are already circulating around the world. And of course, in the recent media stories, we know that within Canada, we had lots of racism that had happened throughout the last 150 years with the construction of railways where migrant workers from southern China were really oppressed, persecuted, violence against them, had tax, and the internment of Japanese Canadians. So those are really not new. What is really kind of magnified is that those type of hatred or racism actually come to surface, and people who are really racist and feel that they can treat other human beings that way just come out and act in ways that caught on to the media and caught on to researchers who actually capture those incidents. So in 2003, I was quite involved with the SARS pandemic. I was actually a public health staff at Toronto Public Health, and I was working at the SARS Control Center. I took all the evening shift because my child was a bit older than my colleagues. And in the morning and on the weekends, I was actually working with the Asian communities to respond to what was happening. There were lots of fears. Again, there were violence in the community against East and Southeast Asian people. And at that time, compared to now, what we had learned in Canada is that this time with the pandemic, all the health units and all the public health agency across Canada and in all the different provinces at multiple levels actually has started providing language access information, which is really a good help. at that time, we were not able to actually find any information. So there were misinformation happening, lots of fear and anxiety, lots of racism incidents being documented. So my colleagues and I actually joined the coalition. And within 2 weeks, we were able to actually start a hotline with 3 Chinese languages. And we were able to actually recruit 90 volunteers and train them so that they can staff this hotline. And it could not have happened if we did not have coalitions or partnership that we had already established in the past, not to deal with pandemic, because that was really new for everyone, but on other issues, on other social justice issue. So in one of these pictures, I am actually there, and those were the younger days. I was there actually talking about how to staff a hotline because I had training in the AIDS and sexual health info line working for the provincial government prior to that. And so when this February, when the federal government actually called for proposal to address the pandemic that we still know very little about at that time. People are still wondering whether would it even affect Canada. This is just something that is happening in Asia. And people remembering SARS would think that, well, last time it didn't really affect us that much. We have 8 days to actually put in a proposal. When I saw that call for application, I right away thought about my colleagues and I emailed them, call them and tell them that this is something that we must do. Based on what we learned from SARS, we can't just watch what happened, and this is an opportunity for us to do this. And so at that time, this is actually quite similar to what happened during SARS, when the first case was identified, and people again, and our public health official at the time still talk about that there's no community spread, is really from traveling. So that's very much like during the time when we went through SARS. And here is a diagram that I really want to focus on because we are here at a dialogue with about city building. And I really appreciated when Pamela connected with me and say, I think your research really fit into city building. Very often I'm teaching a theory course in a PhD program in urban health. People had the misconception that city building is really about architecture, about how we actually lay out, places and spaces. And those things, of course, are really important. But I personally and professionally believe that city building is really highlighting the interdependence and the interconnection between people, environment, and is really social, political, as biological, all those elements are actually totally connected. And so I'm showing here a picture about what made us to be able to write a successful proposal within 8 days was because we had established relationship with many marginalized communities because my research work had always focused on health equity. We had practice network so that we're able to actually connect to people in different disciplines. We had built up trust in the past, and of course, there are trust that we were building, and trust is not to be taken lightly because it really depends on how we interact with our colleagues, with our stakeholders, with people who are actually holding less privileged positions in society, who had experienced lots of marginalization. We had a research network. We had a track record. So all the team members actually had track records of shared leadership. So we don't just take off and just declare that this is our work and we are going to do it. And also from lessons learned. Even though SARS, the impact was not as the way it is with COVID-19, many of our Asian community actually suffered a lot. At the time, I was also seconded to go and help with community forums and town halls because we had migrant workers who were from the Philippines. And when the news media put out that there's a church that actually had an outbreak and many of the members of the church were Filipinos, we had migrant workers who were working as living caregivers who were fired on the same day. And their staying in Canada depends on the visa and the work permit. And there was chaos that came out. And so we had to respond really quickly and build relationship and bringing out laborers, association and people to coming out to calm the community, as well as working with the different politicians to figure out this is unacceptable, that we cannot just do this. We cannot just let people be fired and be left with nothing when they're in a country that they actually don't have protection as citizens and residents. And the intersectoral collaboration is really, really important. It was important. It's still really important. We were able to start the hotline because the Taiwanese business community, a woman that I've worked with before in an empowerment education, actually donated space. They clear space in a mall right away so that it become a training room, it become a hotline room. We were able to get businesses to donate money so that we can set up telephone lines. And we didn't have cell phone that much easily acceptable way back then. And we were able to pull in psychiatrists, clinicians, social workers, community health promoters to all get together and actually did the training. We wrote up the training manual within a weekend. And with this time, with the COVID-19, we had been able to actually pull some evidence-informed application that we had already been using to address stigma of HIV and mental illness in our communities. So this is a quick slice of our team members. So you can see that we are from different universities, different disciplines, and more importantly, we have collaborators who have been working in social justice, and we have community leaders who are very connected to the Asian and Chinese cultural communities. We had people who have worked years in doing community mobilization, mental health association, and of course, like Olivia Chow, who's part of Ryerson, and nursing student association. We have communicable disease specialists from St. Mike's Hospital, people from Toronto Central Local Health Network, which is now another name. And we also were able to actually get Dr. Eileen DeVilla and a director from Toronto Public Health to join us, and a research chair from implementation science from Women's College Hospital. And all this were done within 8 days. Getting support letter was not fun. Those are the days we slept for 3 hours. So again, I want to highlight that COVID-19 had lots of shadow pandemics, and the two shadow pandemics that really need our attention is racism and mental health challenges, and the kind of structural violence that had been here for hundreds of years is really bringing out and making all these challenges even more magnified and in a more severe situation. And so I would like to actually point out that this is a Mobius strip, and this is one of this mathematical model and diagram that fascinate me, and really I'm very happy every time I have a chance to use it, is to really look at how the affected community, insider, outsider, politicians, ordinary people, we are really continuously connected. And so for us, grassroots engagement is very important because we can have public health rules and guidelines, but without the participation and buy-in from the grassroots, we're not being able to deal with the pandemic. Evidence application is very important. So we had to be constantly be aware and ready. Access to information is also really, really critical. Currently, we're facing vaccine hesitancy, and that's tied to a lot of misinformation and distrust from the past. And so the communication part is really, really important. again, collaboration really guides us through the entire ongoing cycle, and resource mobilization is also very important. So with our ProTech model, what we did is that we know that we need to do some program that actually support people right away, burned out, high stress. So we are doing it through the PACER training, which is the Pandemic Acceptance and Commitment to Empowerment Response training. Then we also have the COVID-19 Info Hub that actually provide information more than just how to prevent getting COVID-19, but we actually had resource information to support people to understand these are the feelings that you might feel. This is how you can promote your mental health. This is how you can do health self-care. And also we had linkages and information so that people who are experiencing racism or xenophobia, that they can connect with other community groups so that they are able to address some of this. And I want to share an inspiring story. I was teaching in the summer, and one of my graduate students shared in tears in class that her son was bullied. And their background, their ancestry is a Filipino community. Children were born here, but they were being bullied online and being called viruses. And so the son was getting very depressed, didn't want to go to class online. And I shared with the class that we had this collaborator who were actually doing survey on reporting incidents of racism. So my student and her son actually work on it together, show him the website, and he filled out the survey and had a chance to talk to his mom. And after that, he was very energized, and he actually wrote to the teacher at school and asked to actually do something about racism at school. So community resources for people to access actually could be very empowering. And, we were really inspired by our student and our colleague in class. And so then the other thing that we want to do is actually, how do we inform the future? So all the work that we're doing within this study will be analyzed, and then it'll be turned into a framework. And this is really our framework SPARK, is systemic pandemic active response collaborative framework. We want to learn from our challenges and our facilitators during COVID-19 so that we can actually come up with a model how to mobilize communities at the grassroots and work with policymakers and service providers at multiple levels so that we can really have inclusive and effective response. So capacity building is also another underlying principle in our project. We had volunteers who work with us on Community Info Hub. We had amazing volunteers who come and actually work with us about technology. And that was important because by the time the funding came in, we were going through lockdown. And so everything had to go online. And so we had to turn our intervention into online. We have recruited over 60 live chat volunteers who came through the training. And in reflection, because we just did our 1-year evaluation reflection, we realized that at that time, having the opportunity for people to participate was also very healing and very supportive for them. And the volunteers were really amazing. We rolled out the PACER training. We were able to get the platform done by June, and we had rolled it out. And we continue to do community engagement. So it's really a very complex project. And so you can see here that I was talking about the kind of information we had on the information hub. And here you see that we had also resilience dialogue, which webinars that we promote to the communities. Some are in English, some are in Mandarin, depending on the speakers and the topic in response to the community, and some are in Cantonese. And now we also posted them to YouTube. And for us to actually identify the dialogue that we need to bring in speakers depends on what's happening in the community. So our team actually and our staff team kind of work nonstop in a sense because we have to pay attention what is happening. So our recent one with the vaccine, that was really a request, and also based on the misinformation that we became aware of, we had addressed racism with Black and Indigenous communities and also about long-term care. Another thing that we had done is actually interviewing our community partners because when there's so much information overload and chaos out there, sometimes there are resources and people don't know how to access them. So we actually interviewed our community partners and then we showcase them and post them on YouTube so that people can actually go and look at this information and learn more about what kind of agencies are producing, what kind of activities, what are they doing, how can people engage in it, how can they be supported. And another thing that we did was right in April, we found out that one of the downtown nursing home was really having a severe outbreak, had many loss. So there were lots of grief in the communities and they were also burned out and there were staff who were in quarantine. They really need staff. So how our project engage is that we right away brainstorm a program so that we were able to actually have volunteers and myself and other colleagues who go in twice a day online so that when the healthcare providers, social workers, and workers in the nursing home were having their break, we actually do an online stress reduction program with them that engage them in telling their story, engage them in mindfulness, engage them in everything that actually just give them a break from the heavy stress and grief that they were going through. And we also connected with the Registered Nursing Association of Ontario and tell them that please, advertise that this is a nursing home that really requires staff. I wrote to all my nursing students, my colleagues, so that we were able to actually connect people to the nursing home so that they're able to actually increase their staffing. And so this is the PACER program that we feel very proud of. By this weekend, we will have trained 200 frontline service providers who came in with score 9 out of 10, 8 out of 10, 10 out of 10 stress level, and also community members who had lost their parents or grandparents to COVID, and people who actually had experienced racism. And so this is an online program that people learn on their own at home with the flexibility of anytime they want for an hour and a half. And then they come to an online Zoom meeting for an hour and a half. And our evaluation has shown that their stress actually level had gone down. We use pre and post and 3 months post survey. And we also use focus group. And we had lots of feedback to actually talk about. And there were people who actually contemplated suicide in April. And they find that being able to talk to others in the group meeting and share the experience and realize that what they were going through is real, that what is really bringing a lot of suffering in their life is actually shared by other people, and that had been going. We will continue to roll this out in 3 languages because that's what our project started with. And so every month we'll be rolling out at least 2 to 3 cohort. And with capacity building, we had trained 20 graduates who had come through a train-the-trainer program, pass our exam and practice evaluation, and they are co-facilitating with us. And this is the only way we're able to do this. And so I will stop here. And where do we go forward? We are in the process of planning how we can do grassroots policy activism. I personally, after working many years in community health, public health, being a researcher, being a professor, being a citizen, I believe that policy cannot be at upper level only. We must do grassroots policy where people who are affected had a say about how policy need to be. And I hope that this will go well, and I hope that many of you would join us to actually do this. So I will stop sharing. This is our website, projectprotect.ca. We hope that you can come onto our website and check out our information and program that we're doing and the kind of community engagement that we're doing. And I'm going to stop sharing right now.
Josephine, thank you so much. Thank you for sharing your research, but also just thank you for being so engaged in community and for using all of the skills you have in your capacity as a researcher in service to community at it, well, both in the SARS pandemic and the time in between and the time that we're in right now. I've got some questions for you, but I really want to encourage our participants. If you have questions you'd like to ask, we can, because we're a small group, you can turn on your audio if you'd like to, or you can use raise hand, or you can put questions in the Q&A and I can read them out to you. So I'll give you a minute just to start to percolate. I suspect you have lots of questions. Josephine, I'm going to start with a couple for you with the hope that our colleagues join us in a minute.
Sure.
The one I want to start with is, it's clear that your leadership has been impactful in terms of informing how interventions can be more equitable and community-minded. Once the critical period of the pandemic is over, what's the enabling infrastructure that we need to build, or what kinds of interventions should we focus on so that, I mean, there are so many things when I was watching and listening to you talk about the ways in which you were able to mobilize during SARS. There were so many factors that depended on foresight, but also just pre-existing relationships.
Yes.
You can't mobilize that quickly in a hurry. It's hard to make new friends during a pandemic, right? You were able to activate the networks you have. So you've now seen twice the power of those durable relationships and of the trust and of the track record together. What should we be doing when we aren't in an emergency to try to make sure that that capacity for resilience is there? We hope we won't need it, but given the uncertain future, we probably will. What can we do better when we're not in a pandemic?
So I think from a perspective as a professor, and Pamela, you are also a professor and a researcher, I really think that community succession is very important. Yeah. In the last 20 years, every program that I get involved, for instance, there's an HIV treatment peer counseling program that we started out in 2003, because there is just like HIV treatment is so complex. People who have language barriers, people who are refugees, people who are going through so many challenges and stigma find it really hard to understand that. So we went with very minimal resources, my colleague and I, and a couple of other activists who have been working in HIV, in the mainstream HIV sector. We came together and we put a curriculum together, and we start, engaging people through 4 weekends of training, all day training, Saturday, 4 Saturdays. And over time, as we see that people now are better able to gain that information, we see the empowerment, and it's really inspiring for me to see that people at first who were very stigmatized, they were feeling so down, feeling that, they are nobody and all that stuff, and their leadership quality just show up. So then what we did was we started doing peer facilitator training. So they came on board and do the training. And right now we are actually going through the second cohort where we're doing mentors training so that I don't have to do it anymore. So community succession is really important. I do that with my students too, when students from all over the different countries and here, and they want to know whether I would supervise their dissertation. My first question is, what's your underlying principle? Right. And so I made it very clear that when you complete your PhD, only 80% belong to you. The other 20% belong to the world and the communities that are affected. So do you have the same kind of value as me? If you do, then let's work together. And so when I find students who really care about equity, about justice, then I would put my whole effort into supporting them so that they will be successful and build capacity. So I'll bring them on board onto research And I'll also slowly push them to become mentors to undergrad students. But in the community, you are right. What I really worried about is that when the COVID-19 so-called emergency is over, we just go back to the previous way of life. We cannot do that. To me, every day is emergency, because the kind of challenges faced by some of the communities are just not visible to us. It's an emergency to them. And we see that with the community I have worked with, people who are living with the challenges of HIV and mental health challenges. And this COVID-19 become really very devastating in their life. And so apart from doing COVID, our other team started working with them to do online stuff, bring people in. So I really think that community capacity building and succession is very important, and also walking social justice, so that when we work with communities, especially very marginalized community, that we don't take that position as if we know the best and we tell them what to do. We cannot really do equity research or work unless we actually embody that and really play that out, because people in marginalized community had lots of leadership and they had lots of wisdom, and they know better that they don't have to listen to you. You can say all you want, they are not going to come and collaborate, and then we're not actually doing what needs to be done.
It's so interesting, Josephine. I think there's a really strong parallel. Earlier, you talked about the connections between city building and the built form and the kind of work that planners do, but also the kind of work that you do in urban public health. And one of the same challenges I think both of our professions face is that we often do our work inside big institutions, and big institutions do a very bad job of showing people that we see them and that we recognize them and that we value them. And so when we're working with planning students, when we're holding public meetings, the standard that we talk about inside our program is like, make the community members who come feel so welcome, like set it all up so that you show them you already knew that they were going to come and you're so glad that they're there, right? And so it's about meeting people where they are. It's about really believing in the significant expertise that comes from lived experience in communities. And so it's, there are so many examples in the SARS network that you mobilized and the work that you've carried on, where you basically created the enabling infrastructure for that expertise to come to the surface and to be put into action quickly. But one of the reasons why you could do that was because people trusted you and your colleagues. And I want to pick up on this issue of trust. And you talked about vaccine hesitancy. And I've been saying recently to our students that vaccine hesitancy exists in part because of inherited broken trust in institutions, that institutions failed people before, and so now they're not trusting them now. And so do you have other thoughts about how we can get institutions to actually behave in more trustworthy ways so that we don't arrive in an emergency where people don't trust the institutions that are supposed to be there to support them?
I think that is very difficult. In my younger days, I was much more idealistic. However, I do feel that there is hope in the sense that very often when I teach very heavy subjects, I promise my students that I'm not going to let us leave the classroom unless we feel hopeful. And I think that is something that is very important, because we could just feel very sad, and then that would drain our energy about social change. I also often hold myself accountable. And that's something that I learned through the years, when we say that, the institution is really hard to work in institution, but I am part of that institution. So am I willing to take risk, to speak out in a way that maybe some members of the institution will be mad at me, or I could be put aside, be dismissed? But would I, because of that fear, stop speaking? And so I think the part that to me has supported me is, first of all, I feel very grateful of the network that I have with me. And I know that I will always have support. And when I go through personal challenges with family members being very sick and challenges. And I always had so many people who were so kind. And then within the institution, I find that if I would just breathe, don't be too angry, even though sometimes I'm not angry, they just interpret that I'm angry. And that in itself is another kind of oppression. And I just thought that if I would just take time to really think through and always be committed to speak in a compassionate way, then sometimes it's being listened to. I truly believe that most people are not mean people. I truly believe that some people's biases, they are not conscious. And that's what we need to tackle. We need to really look at the intersectional oppression that is happening. I was very inspired by what David Suzuki talked about last night on the National. And when he was asked, what do you think about the rise of anti-Asian racism? And he talked about, well, what do you think? What are you expecting? We live in a society that has systemic racism. And he pointed out that these are the same people who will go and harm Black people, Indigenous people, all racialized people. It's the same, it's that system. And I think that's what we need to do. Is that sometimes I worry about the division. I worry about how when we keep on putting a very partial lens on oppression, it's actually a way to divide our attention when we really need to look at the entire system, the entire institution. And we need to be courageous and bold. If every single one of us are courageous and bold and speak based on principle of justice and equity, I think other people will start to listen, and maybe they were afraid to speak out. And when some people speak out, they're better able to speak out. And we need to keep on challenging privileges, whether it's related to race, class, gender, sexuality, abilities. We need to keep on challenging those because I see that as my responsibility. It's not really just about me doing this work. I always tell my students, and I make them write assignment based on that principle, is that our personal, professional, and political are totally interconnected. And every critical analysis they wrote, they have to demonstrate they understand that part. And so, and it worked. I had many students who wrote me back. I just got a really good email this morning who told me that she wrote an equity piece about people not getting sick pay. And because of the discussion from the class, so I feel very grateful, and I would encourage everybody to speak out based on principles and values that we believe and not be afraid. Fear is the biggest problem, I think, in our life.
I agree. And I think that another piece of this is, we do an assignment that I teach called What Can You Do with What You've Got from Where You're At Right Now? Trying to help people be very active about thinking about what are the assets that I have control over in this particular moment that can be put into service for other folks, right? And so it's being courageous, being brave, and also being practical, I think, and just being aware of where you are.
Yes.
What are the privileges that you have, and how do
Yes.
you share and make a bigger space, right? I think those kinds of skills are really important parts of tangible ways of moving forward, along
Yes.
with the deep substantive reflection around anti-oppression and anti-systemic racism work.
Yes, I totally agree with that. And yes, in my younger days, I was more idealistic, but now I'm very pragmatic.
I don't read you as lacking idealism. I just think
I always encourage, ultimately, I really want us to all answer, like research, we need to know at the end, what's the result? So what then? And then what are we going to do? So I think that part, I keep on reminding myself, and I am very fortunate to have colleagues who feel the same way, very pragmatic, at the same time, very idealistic, because if we don't have ideals, then we would not also pursue, something that could be different. We might get stuck to think that this is just the way the world is, but it doesn't need to be.
Yeah. Okay, I'm going to pause just for a second. Do any of our participants have questions you'd like to ask? I have more, but I am delighted to stop talking and let you ask your questions. So please don't be shy. Just give everyone a second. Josephine, I want to pick up on this tension. You've said a few times that you're not optimistic. I think you are very optimistic in that there is still a belief that we can do better and a resolve to actually do the work, right? And so what are the kinds of things we can do in your capacity? I mean, for example, you're teaching in a PhD in urban health. Maybe you can share with our listeners the kinds of things you're doing in this new PhD program that's interdisciplinary but local in scale in terms of impact. How are you trying to unlock the mindsets and the skills of these students to be rigorous, impactful researchers who actually get real things done, which is a very Ryerson thing?
Yes. Um, so I have made a commitment that all courses that I teach, regardless whether it's undergrad, master, or PhD program, is to decolonize and indigenize knowledge. And I think that part is very important. And so I'm teaching the theory course right now, and I'm not kidding you, I spent at least 100 hours putting that syllabus together.
Sure.
And because I really want, so I start by saying, what is urban health? So then there's all the ordinary discourses about what is urban health and everything. And starting the second class, we talk about what's theory? Why do we need theory? So that we can actually also start challenging positivism, to think that if we find some method that can come up with numbers and all that stuff, that's the fact, that's the truth, and that's what policy had to go in. Then I start with decolonial and indigenous knowledge, because I want that to be the starting point, rather than us always reading about Eurocentric knowledges, discourses, and get that all in our mind, and then we undo it. So I deliberately, and throughout all the 12 classes, I integrate that in. And also bringing in indigenous knowledge from Asia, from other parts of the world, and finding, material that actually really show the commonalities as well as the differences. And I am happy to say that at the beginning, students were wondering, what is this about this theory? And I kept on saying that this is very important for your, comprehensive exam and defending your proposal. But now we're really engaging in a very critical dialogue, and it's really wonderful. And my students are really wonderful. Our first cohort of this program had amazing students with lived experience, with critical thinking, and very collegial, and very supportive of each other. And I think that is really amazing. And in my teaching of the globalization master course, I also designed that, as I told you, that students need to write critically, scholarship, but also acknowledge that they are part of it. And I integrated a lot, where I also bring in about racism, the history, the kind of more real history of Canada. And students seem to, and many of them actually wrote and said that they didn't understand why they didn't learn that in undergrad, program. So I told them, write to your director, make sure that it's in the program. So that's how I'm pushing things forward. But the good thing is, at our school, we recently got a small grant led by Dr. Annette Bailey, and we will be addressing anti-Black racism in our curriculum. So we are actually pushing things forward.
That's good to hear. And I think those kinds of grants, we have a similar thing in the planning school where we're trying to integrate anti-Black racism and anti-Indigenous racism and anti-systemic racism programming into the core of our program. We want to reshape the planner's lens, centering these values. And it's a long process of change, but very important.
And I think that, Pamela, I think what will be really exciting would be more collaboration too, right, across different departments. I think it'll be very exciting, for your student and our student to actually have that kind of exchange too.
I agree, especially given your earlier points about broadening the perspective about what constitutes city building. Certainly, planning's beginnings began in public health, right? And so this connection between the social determinants of health and built form, it's long been appreciated, but our professions have come together and moved apart. And so it's time to reconcile and bring back together, I think, particularly if we want to be inclusive, equitable, ethical, and responsive to the needs of people where they are. I'm going to end on one last question that focuses on impact. Josephine, how do you measure success in your research team and in terms of this project? What are the things that you look to? What are the key performance indicators? And how do you define success?
I think it also depends on which project. In the last few years, we had been focusing on intervention and implementation science. And I know that one critical colleague say, what are you intervening? Because that word actually is loaded, right? What are we intervening? So I reply with a big smile and say, I'm intervening in justice and I'm intervening inequities. And so how we measure is actually, because my background was from public health, and I'm a qualitative researcher. I've worked with quantitative researchers. We use mixed methods. We bring our data together so that it's not like you go and do this, you go and do that. We actually look at how they actually inform each other. And one very wise things that we did was when this intervention that we talked about, it started out when we did a stigma study and find out why people are not addressing stigma. And we went and did a community forum and 3 forums, and we asked the participant, we can go and get a grant and deal with one of these. Here are 5 models of anti-stigma intervention. Which one do you want? And the participants say, I don't want one. We want 2. Right. So we say, okay, fine. Let's see if we'll be successful. And we did. And that was really amazing. So listening to people with lived experience was really amazing. And we came up with an innovative program that actually integrate a psychological therapy with empowerment education. That is really important for activism. Right. And the other part that I integrated into the design was how public health evaluate. So instead of measuring people's intention, do they intend to speak out against stigma? Do they intend to do something to take care of their own stigma? We actually had activity logs that actually demonstrate that out of 62 people out of the first project, they carry out 1,090 activities in the community, in organization, in their own personal life, and also internationally to communities that they were network with. So we use indicators that can be measurable, but at the same time, we really tap into a lot of the qualitative narratives that really bring out the meaning and experience of people's life and their stories rather than only numbers, because people are much more than numbers.
It's so, your story about having your participants say they didn't want one, they wanted more than one. Sometimes in planning, the answer we get is all of the options you've given us are unacceptable. So the yes and one is easier to work with because it gives you a foundation to put things together. So that's encouraging. Josephine, I'm going to say thank you here. It was really, thank you for making time, especially given you're doing this research in real time in a pandemic, helping people who are doing such vital work, but also like time that you've given us is time taking away from other important work you're doing. So thank you for the opportunity to learn about your work. Well, thank you for the long arc of impact. And thank you for helping to, through education and research, engage the future generation of practitioners. So we're very grateful, but also I appreciate the chance to learn and listen.
Well, thank you very much for your kind words. And I appreciate to have the opportunity to dialogue. I think that's really important. I'm learning more about city planning and have a chance to engage, and I'm grateful for that. And thank you so much.
Well, at City Building Ryerson, we hope this is the beginning of a longer series of conversations and, more importantly, actions that will make a difference, both in terms of the science of discovery, but also meaningful engagement in the lives of our community members. Thank you to our participants for coming. Thank you to the team at City Building Ryerson. And this recording will be posted on City Building Ryerson's website so that other people can learn from it too. Have a great day, everyone. Thank you.
Thank you. Bye-bye.
Bye.